Well, it was hard to say what can be Indian perspective because we have no such way to find out what's happening all over India. For me, decision making is if you can deliver to your patient what he wants with best of your ability, that's the decision you have to take. So there's so much written up, so many people can do so many things, but what will satisfy your patient is what the decision has to be all about. So I did a mini survey. So I questioned 2 north, 2 south, 2 east and 2 west, 8 high volume surgeons in the city in India to find out what is their profile of decision making. And I asked them 2 questions. What percentage of your instability surgery is arthroscopic, oblique, Latarjet? And second question was, out of 100 instability that you do, how many are first time dislocators? So these 2 questions on WhatsApp yesterday morning, and I got the reply by evening, and let me put it up to you. So this is the answer to first question. In the north, 95% to 99% do arthroscopic. In the west, it was 75-25, first surgeon, second surgeon, more than 90%. So heavily loaded towards arthroscopic. In the south was again 80%, 70% arthroscopic, which is quite okay. But surprising was the east. One surgeon said 90% plus arthroscopic, second was 60% Latarjet. Now that's something I couldn't understand. Anyway, so there was a variation. Second question. In the north, almost never no surgery for first time dislocator. In the west, almost 30%. In fact, one of the surgeons says, I always advise surgery to first time dislocator. Some of them refuse. So very heavily towards operating on a first time dislocator. East was again 5 or never, which is same, and also in the south. So you can see in the western part of India, they are heavily loaded towards operating or advising operation for a first time dislocator. Just to give you an overview of how the practice is all over India, because I can't represent India here. Now, so treatment of instability, this is probably an Indian perspective. I can't say it is an Indian perspective, but maybe. And maybe I'll justify that what I'm saying is probably represent India. So we know we decide by pathology. If it is a mainly soft tissue lesion, we do soft tissue surgery. If it is mainly bony lesion, we do bony surgery. And in my own data, which is unpublished, loss more than 25%, which is a very clear indication of a open surgery or a Latarjet, open Latarjet, was only 1 in 30 cases, which was very low compared to what is published in the literature. Functional demands. Now there is a patient on the left and patient on the right. They are different patients. So their demands are different. So whatever anatomy may say, their requirement is different. So surgery is going to be different. In my own data, 3 out of 30 were on the left side, which means 10%. 10% of my population, or if I represent India, is only high demand athletes. Rest of them are you and me. So probably my decision will change depending on left or right. What is the patient's choice? And this is very peculiar, and I don't know why my colleagues sitting here would agree to this. There are patients who want one surgery, open or arthroscopic. I have just this much money, do what you like, I don't want second surgery. On the other hand, there are a lot of patients who say, I don't want open surgery. Doctor, no open surgery. There's a big phobia about surgery in India overall, and open surgery all the more. And they say, doesn't mind, I don't mind repeat surgery, but do arthroscopic first. If it fails, maybe I'll get open surgery done. You can do open surgery tomorrow, is it okay? So in Hindi they will say, हो सकता है ना open surgery बाद में, अभी arthroscopic कर देने का. So that is the 2 kind of patient I have, and I have to decide which is the patient I'm dealing with, left one or the right one. And most important, what can my patient afford? So there's a patient on the left who is the richest person in India. He can afford anything. You can give him the best and he will want it. On the right side, the poor guy has no money. Just one chance he will give you, collect his money from home, and you have no choice to fail. So you have to do something which will work, whether it restrict movements for 20-30 degree, it doesn't matter to him. So all these things decide in my decision making about surgery. And of course, in bone loss, there is a literature. If there is a bone loss of X amount, and this is Sugaya's paper, even up to 24.8%, all kind of bony bankards, he did arthroscopic repair and results were quite good. And there was a paper published in up to 25% bone loss in a low-key population. And I think our population is moderate to low key. The results were 83% successful. So this was quite encouraging to me because it fitted my ideas. So I thought we are not. So I reviewed my own results. Out of 100 patients, out of 144, I followed up 100 patients, minimum 5 years post-arthroscopic Bankart repair. I asked them 2 questions telephonically. Have you ever dislocated your shoulder after surgery? Do you have any problem with the shoulder, operated shoulder? And what kind of sports do you play? And this was the answers. Only 6 out of 100 had dislocated 5 years down the line. And only 4 dislocated and 2 were actually problem, not dislocated, but they were insecure. They were not happy. And believe this, 90% were office goers. So this is the kind of population that we deal with. So our operation has to be fitting to that population. And the one who dislocated, out of the one who dislocated, only 1 out of 4 had more than 20% bone loss. I reviewed my operation notes. So it was not the bone loss causing recurrence, it was many factors. So to conclude, Indian instability practice is heavily loaded towards arthroscopic surgery. That's my conclusion. Are we the best surgeons in India because our results are so good? No, that's not correct. We have good patients. And who are these good patients? Low activity, don't play rugby and things, don't mind giving up sports after surgery. They say, oh, I will never play sport in my life. Once operated means over. Happily willing to change their lifestyle. So our patients are such that they do very well with simple operations like arthroscopic Bankart repair, even in spite of reasonable loss. And this was a great debate we had in 2017 when I was pitted against, the boss of shoulder surgery, Christian Gerber, and Dinsha, who was moderating the show, asked the question at the end. And this was, shoulder surgeons of India. And he asked, how many of you will get arthroscopic surgery done on yourself? And this was the answer, majority. Which means I think I represent the Indian context and probably arthroscope. And the reason is very simple. This picture says it all. We are a different culture. So we have to treat our patients, we have to treat requirement of our patients, what can they afford, and so many factors. And I think arthroscopic surgery in the average hand of a shoulder surgeon here does very well. Thank you.